Hi, I'm Shane Bayless, dochockey for Proactive Sports Injury Clinic. Today I just wanted to talk about some of our patients that come in with pain or a biomechanical problem and how we kind of deal with that. So we're talking about load versus capacity. Everything usually has to do with load versus capacity because that's what makes us be able to be functional as well as do our normal everyday activities. So when we're looking at load versus capacity, we have load. If it equals capacity, we get health. Okay? If we're looking at load is less than capacity, we get health. All right, but when load is more than capacity, we start getting dysfunction, which usually results in symptoms after a little bit of time. Obviously, when we're young children, we fall down or whatever, we may hurt our hip, but it goes away pretty quickly because we have a big buffer capacity for symptoms. So what we do here is we treat the dysfunction, which is usually scar tissue. We're trying to break down scar tissue because scar tissue doesn't contract or stretch, which makes us inflexible and weak. All right, so when we get rid of the scar tissue, we can normalize the load and restore capacity. All right, and then we decrease the dysfunction to unload the pain generator. So we unload the joints, so if there's scar tissue being put on there, it doesn't flex, so it puts pressure on the joint, and we're weak, so we're not strong through that joint, so the joint creates a pain generator. We get rid of that, people can start doing their functional abilities, like at home, everyday activities, as well as doing their sport and better performance. Hope that helps with how we do things at Proactive Sports Injury Clinic. I'm Shane Bayless, dochockey. Have a great day.